was recently diagnosed as CA breast and on treatment, and she has had irradiation recently and tablets also. Now she obviously is immune compromised, and she came with extensive pneumonia with cavity formation. She is immunocompromised, and she developed a terrible pneumonia which led to a fall in oxygen, and she was very breathless and sick and fever, and the CT scan showed massive changes of pneumonia in the right side, especially a cavity formation. ये मैंने दिखाया था आपको cavity, और ये है वो cavity जो कि तकरीबन हफ्ते 10 दिन के बाद शायद जब दोबारा CT किया हमने, तो वो cavity almost disappear हो रही थी. It became much smaller, very little size here. So as compared to this, you see, as compared to this size of cavity, and there was lower lobe pneumonia, the cavity size had become almost negligible. तो हमें ज़रा लंबा देना पड़ता है. तो a few weeks, up to 6 weeks normally. तो अभी हुआ नहीं, हम नहीं चाहते कि दोबारा से ये फ्लेयर अप हो जाए. So we'll give it for another week and then have a call on that after 10 days, let's say after 10 days. And in the meantime, I can probably stop another expensive drug, which is Andalfa. Andalfa we can stop today because she had Candida, which growth was Candida tropicalis. She had Candida tropicalis. So these are the cases which we see in immune compromised situations, multiple infections, patients going into respiratory failure, going into the ICU. So we had to immediately act and take action against all these bugs, and then see clinically how is the level of improvement, and then what to stop. Is equally important is what to stop and when. So we are at that stage. Hopefully she will continue to improve, and these shadows with time will improve. So we have found that the cavity size is further shrunk, and it's almost not seen now. The cavity is not even seen now, and so I put her on intravenous antibiotics, antifungal, and we had to give cover for PCP and CMV also, because she had Klebsiella, she had Aspergillus, she had Candida tropicalis, she had PCP, and she had CMV. मैंने आपको बताया था कि 5 तरह के बैक्टीरिया, वायरसेस, फंगस, 2 डिफरेंट टाइप्स के वायरसेस, ये सब कुछ ही ग्रो कर रहे हैं जब हमने बाल लिया था. So finally, aggressive treatment, antibiotics, IV, and supportive treatment, and antifungal, सब कुछ देने के बाद में within a few days she started to clinically improve. उसके बाद में अब to the extent कि इनकी ऑक्सीजन जो थोड़ी देनी पड़ रही थी हमें शुरू में, ऑक्सीजन कम थी, 81% के करीब थी, वो अब नॉर्मल है. 98 है, 98 comfortably. She is without any breathlessness, orthopnea or anything, and she has not been febrile. Now obviously there is no radiotherapy going on at the moment. Now what is the purpose? This is today's mid-zone shadow. There is no cavity seen here. Okay, there is no cavity now, but there is still right lower lobe. This is right lower lobe shadow, which is much less. It has shrunk much less than before, but it is still there. Maybe 30% is still there as compared to what it was earlier. So we'll continue with some antibiotics for the time being. The question she put me was, when are we going to stop Zisabel? Zisabel is antifungal, it's expensive also. So probably another 1 week